Hi, I'm Tamara Kandaker, and you're listening to the Decibel from the Globe and Mail. So we've started hearing health experts and officials refer to what we're seeing now with COVID-19 as a pandemic of the unvaccinated. And that's great news for places like Canada, where more than 50% of the population's already gotten both shots and where the number is still rising. But as public health campaigns try to reach everyone or convince that minority of people holding out to get vaccinated, it's worth remembering that in much of the developing world right now, getting vaccinated isn't an option. That's why the COVID situation in Africa is dire. The regional director of Africa for the WHO, Dr. Matsidi Somoeti, said last week,
"Let us be under no illusions. Africa's third wave is absolutely not over."
After a 2-month surge, the rate of new cases did fall by 1.7% last week. But if you take South Africa, where the situation seems to be improving, out of the equation, cases are still rising across the continent. The Delta variant's been spreading like wildfire, and barely anyone's been vaccinated. A lot of this, as we're going to talk about on today's episode, is the fault of countries like Canada. And the longer it continues, the more likely it is that it'll have direct consequences for us too.
People underestimated the degree of selfishness of wealthy countries, and they underestimated how much financial muscle and wealth would be used to ensure that they would be at the front of the queue and would have a range of vaccines under its control at a time when other poorer countries don't have any at all.
Geoffrey York is the Globe's Africa bureau chief. He's based in Johannesburg, South Africa, and he's been covering vaccine inequity and the political crisis that's broken out there in the middle of the pandemic. He's on the show today to talk about who's to blame for Africa's COVID crisis and why we should be paying attention. You're listening to The Decibel. Geoffrey, hello. Welcome back to the podcast. Thank you so much for being here.
Thank you.
So, Geoffrey, I'm in Canada, where life looks really different from where you are in South Africa, also really different from the rest of the continent of Africa and actually in much of the developing world. Because we have a high vaccination rate here, we've been able to lift a lot of restrictions and life is feeling a bit more normal, but that's obviously not the case in the rest of the world. And I wonder if we can start with why you think it's important to talk about this and why we should be paying attention to the state of the pandemic outside of Canadian borders.
There are two self-interested reasons why Canadians should care. By having the pandemic continue in places like Africa, new variants are going to continue to emerge. I mean, we've already seen this with the Delta variant, which emerged in India. So all the experts are saying that this will continue to happen if the pandemic is not controlled in the entire world. Mm-hmm. But the other factor is the economic damage. Canada is a trading country, and it depends on the health of the global economy, including the emerging market economies. Global supply chains are being disrupted by the Delta variant, causing damage to many global companies. There was one study that estimated that the global economy could lose as much as $9 trillion if there's not equitable access to vaccines globally. The moral reason is simply the fact that thousands of people are continuing to die in low-income countries from a preventable disease. Preventable at this point because vaccines exist.
Mm-hmm. And the other thing that actually comes to mind for me, just being in Canada where there are so many diaspora populations and knowing people who have family in countries that have been severely impacted by this and haven't been able to get it under control, a lot of us are not going to be able to see our families until these places are able to catch up to the rest of the world in terms of vaccination, right? That's also another concern.
Yeah, I think that's a big concern. We're already seeing a lot of concern in places like Africa and other parts of the developing world that the travel bans will be very unfairly imposed. I mean, at one point we saw a European Union rule that was introduced just a few weeks ago that basically says that you're considered vaccinated if you are vaccinated with vaccines that are approved in Europe. Mm-hmm. And that excludes the AstraZeneca vaccine that was manufactured in India, which is the main vaccine that most of the developing world has been using. That's a huge concern for much of the world. And as you say, it's going to disrupt diaspora connections. Certainly, it's already having a massive effect on tourism, leisure travel. We can't just assume that Canada will be turned into Fortress Canada and pull up the drawbridge and prevent other people from coming in, and that will solve the problem. It won't.
And so tell me what's going on where you are and what the situation is with the pandemic in South Africa. What has it been like to be there?
Well, the third wave in South Africa, which began a few weeks ago, has been the worst surge in South Africa since the beginning of the pandemic. It's finally beginning to peak now, but many hospitals are still very full. So we're still seeing hundreds of deaths every day in South Africa. This is about the fourth major lockdown that South Africa's had. The fact that they are continuing has continued to damage the economy of South Africa. And it was certainly one of the contributing factors for the frustration and anger that came out a couple of weeks ago in the looting and destruction and rioting in South Africa this month that killed more than 300 people.
So as of right now, only around 2% of the African population has been fully vaccinated. And why is that? Why have so few people been vaccinated in the whole continent?
Well, the main reason is the vaccine hoarding by the wealthy countries and the fact that the world decided to put its faith in this very noble sounding idea, very beautiful idea called COVAX, championed by countries like Canada. The idea being that wealthy countries would provide money to COVAX and they would be able to buy enough vaccines to cover 20% of the population of low-income countries by the end of this year. And then when it announced its delivery schedules and we compared it to the realities, we found out that they were only about a third or a quarter of what they promised by the end of June. Basically today, COVAX has almost nothing that it can deliver to low-income countries except for a few donations that it's now receiving from the richer countries. And so this is why we're seeing such a low vaccination rate in Africa. They were depending on COVAX, and COVAX let them down. Companies like Pfizer and Moderna have just clearly prioritized the wealthy countries. Moderna is not providing anything at all for COVAX. Pfizer is providing only 2% of its global supply. The African Union did a very smart thing. It set up a procurement team to pool its purchases for all the 55 countries of Africa. And that was a good idea because if you pool your procurement, you have a greater ability to buy. But the problem was when that procurement committee went out to try to buy vaccines, it found that they were already snapped up by the rich countries.
Yep.
A wealthy businessman named Strive Masiwa, one of the most successful businessmen in Africa, he was the head of that procurement committee. He said he approached the vaccine manufacturers as early as December last year and was told that they were already fully booked and had no available capacity. He says it's like in a famine where the bakery has been taken over by the rich countries and they control who gets the bread.
I guess one question I have is, why is Africa so dependent on importing vaccine? And why are these countries not able to manufacture their own vaccines?
Certainly, that's something that's getting a lot of attention now. But, it's a problem that's been around for a long time. I mean, if you go back to the early years of the AIDS crisis, HIV medicine was again monopolized by the major multinational pharmacy companies. And it took years and years of fighting before there was an agreement that generic companies would be able to manufacture those antiretrovirals that were needed to save lives. But it required an agreement that the patents would be shared, the technology would be shared. So as a result, last October, South Africa and India jointly sponsored a proposal which is now supported by more than 100 countries that would call for a temporary waiver on COVID patents. Mm-hmm. The problem is this proposal has just been basically talked to death at the WTO level. Countries like Canada were not supporting it. They were simply asking questions and questions. Finally, a few weeks ago, the United States, under Joe Biden, said that it would support the idea. That was a massive breakthrough, but it requires basically global consensus. So now it's at the point where Europe controls the decision on what should happen. There's really no sense of urgency. In fact, it was just disclosed that those negotiations will be put on hold for a month for the traditional August vacation period in Europe. Within a few days, talks are going to stop and they'll resume in September.
Do you think African governments individually could have done more to procure vaccines, and when they arrived, could they have done more to distribute them faster? Because I've read that in some places, a lack of planning has been a big problem, and that there has been issues with distributing vaccines, and that vaccine hesitancy has been a problem. So can you talk a bit about that?
Yeah, it's true that distribution is a problem, but it's not as big of a problem as you would imagine, actually. South Africa, for example, has done a very effective rollout of vaccines over the past couple of months. It's been increasing almost every day, the number of vaccines that are distributed per day. Now, as for vaccine hesitancy, I mean, one of the big problems is that COVAX and Canada and the wealthy countries are basically donating AstraZeneca doses to Africa. And these countries have made it clear that AstraZeneca is not their primary choice. I mean, Canada has basically said that it's the inferior vaccine. It's not as good as Pfizer and Moderna. So Africans are not stupid. They see that they're getting donations of the vaccine that is perceived as inferior. Now, it's true, AstraZeneca is still very effective, and nobody should really see it as being inferior. But that's the way the wealthy countries have portrayed it. They've said, you can have the vaccine that we don't want.
So you mentioned Canada's hoarding, and I know Canada's been criticized a lot by organizations in developing countries for doing this and keeping these vaccines from those countries. And I wonder if you can expand on that a little bit more. Like, for people who haven't been following, can you just explain how Canada's contributed to the situation in Africa, and how many vaccines have we donated? How many have we bought that we didn't necessarily need?
The main thing that Canada has done from the beginning is to promise money to COVAX. And it's promised a lot. It's promised hundreds of millions of dollars. And that's very good. That's very generous. But the problem is that COVAX's real issue right now is not money at this point. It's supplies. There's just not enough production. That's why the priority has to be expanding production. Canada has promised eventually at the G7 meeting. They did promise to donate some vaccines. And right now it appears to be about 30 million doses. Now, almost half of those are actually the doses that Canada was going to receive from COVAX, which it was eligible to receive, but it changed its mind, doesn't need them, so it's going to give them back to COVAX. The other 17 million or so would be a direct order from AstraZeneca that Canada had made that it no longer needs. We don't know when they're going to be delivered. And right now, there's a huge shortage at COVAX for July and August. By October, a lot of supply will begin kicking in to COVAX. And at that point, the problem is that there'll be a massive supply surge, and COVAX and the African countries do not have the capacity to distribute all those vaccines.
Yeah, so let's talk about that a little bit more in depth. So what can the international community do to speed up the vaccination process?
Well, the big thing is just to put more pressure on manufacturers to share their technology. Don't forget that the major manufacturers, the Pfizers, Modernas, they develop their vaccines with huge support from governments in the form of either subsidies from some governments or advanced contract orders, guaranteed procurement. So there was billions of dollars that were given to these companies to develop these vaccines. What people are pointing out is that gave those governments like the United States, Britain, and so on, it gave them enormous leverage. They could have negotiated agreements on equitable access. In fact, Moderna took some funding from a nonprofit source, and as part of that agreement, it promised that there would be affordable, equitable access to its vaccine, but it has really done very little. So I think at this point, the governments could be doing more to pressure the manufacturers to share their technology. We've seen a few limited deals. I mean, just last week, Pfizer promised a deal with a South African company to manufacture Pfizer vaccines in South Africa. But when you look at the deal more closely, it was only a fill and finish deal. Fill and finish means that basically the ingredients are shipped in from a Pfizer factory in Europe or somewhere, and then they're simply bottled and labeled in South Africa. That's been criticized by a lot of health experts as being inadequate. There has to be really agreements that the full vaccine is manufactured in more parts of the world. And of course, at this point, it's almost too late. I mean, we're talking about future pandemics, really, where this should be done.
Yeah. You also wrote about something called compulsory licensing. And can you just explain what that is and why Canada isn't allowing it?
Canada actually has a law. Basically, it says that when there is essential medicine that is needed in lower income countries and they can't get it because of shortages of medicine, Canadian companies would have the right to apply for permission to begin manufacturing the product that is under patent somewhere else. So in the current case, a Canadian company called Biolis, it has the capacity to make 20 or 25 million vaccines a year at this factory in Canada, in St. Catharines. And it reached an agreement with the government of Bolivia so that Bolivia would order those vaccines from the Canadian company. But in order to actually do it, it needs permission from the government of Canada. And it's been applying for several months now, months and months. Canada simply has not done it, and they've not explained why they have not done it either. The head of the WTO has actually welcomed this and said it's a good use. Compulsory licensing laws exist and they should be tried out. But for unknown reasons, Canada has not.
Yeah, why would they not allow that?
Well, I think it's a real mystery. I don't think we know. But I do think there's been a lot of lobbying of Canada by multinational companies that want to maintain patent protection on everything. Any weakening of patent protection would weaken their monopolies. They can charge whatever they want, basically, if they have a monopoly.
Have we ever done this before?
There was one precedent, I think it was about 10 years ago, and it involved HIV medicine. And at the time, people were optimistic that this would be a precedent that could allow this to happen again, could allow essential medicine to be provided on an affordable basis. But it took years to get permissions. So they were just quite deterred. They weren't keen to try it again.
Okay, so having said all of this, what do you think our pandemic experience tells us about how the world should respond to future pandemics to make sure that this doesn't happen again and to ensure fairness in our global response to a crisis like this?
You know, we're going to face this decision even as early as next year, because countries like Canada are going to be considering booster shots. Should Canada be giving booster shots, third or even fourth shots of a vaccine to the entire population all over again at a time when many people in the world have not even had a first shot? That'll be the first decision point. And then, you know, for future pandemics, people thought that COVAX would work, but it really has not. People underestimated the degree of selfishness of wealthy countries, and they underestimated how much financial muscle and wealth would be used by those by the wealthier countries to ensure that they would be at the front of the queue and would actually have a range of vaccines under its control at a time when other poorer countries don't have any at all. So I think probably the lesson is that many parts of the world are just going to have to be a lot more cynical. They're going to have to assume that it's a race for vaccines right from the very beginning. They're going to have to scrape together money from any source at all to begin ordering vaccines at the earliest possible point and not believe any of the promises that are made by wealthy countries about sharing plans and donations and so on, because those plans just take so long to develop that in the meantime you have thousands of people dying.
Geoffrey, thank you so much. I really appreciate it.
Sure, no problem.
All right, that's it for today. I'm Tamara Kandaker. Our producers are Madeline White and Kasia Mihailovich. David Crosby edits the show. Angela Pacenza is our executive editor. Thank you so much to Geoffrey York. You can find him on Twitter at Geoffrey York. And if you're a Globe subscriber, I'm going to be talking to Jeff about COVID in the developing world and Africa in particular live on Friday at noon Eastern Time. And if you want to know how you can attend this virtual event, you can go to theglobeandmail.com. Thank you so much for listening, and I'll talk to you tomorrow.